I'm gonna put my lube down. I'm gonna throw it away. I'm going to grab the inside of my glove. This can be dirty. The inside can be dirty. And I'm going to put my hand in. Now granted, I'm typically not very good at this, so I always have to readjust. Okay, my hand looks stupid. It's okay. It's still sterile. I can grab this one. I can never put these gloves on. I suck at it. Oh yeah, I recorded them. Okay. Again, my hand looks stupid. It's okay. I can always readjust. My hands look stupid. Don't look. Don't laugh.
They look like a grin.
But I can readjust. That's the best thing. I'm sterile. Now I'm sterile, and now I can readjust. Hey,
This hasn't happened to her all day.
It really hasn't. Okay, now I'm sterile. I've readjusted. I typically have to readjust every time, no matter what, so it's fine.
So do you have to wear the gloves from the kit and not on the...
Yes, so these are sterile. These come in this kit. These are sterile. These have not touched the outside world until now.
Okay.
Now, everything in this kit is sterile still. Don't look at those gloves. This is all sterile. Okay, I can touch this, and I can touch this. Everything is still sterile. Now, when I get to this point, I have to decide which hand I want to be dirty and which hand I want to be clean. I am right-handed. I would choose my right hand to be clean and my left hand to be dirty. So, I'm gonna wrap this to keep that clean. I'm gonna grab my suction line. I'm gonna connect it here. Now, this hand is dirty. I cannot touch any of this with this hand. If you touch any of this with this hand, you might fail. It just is what it is. Now I'm dirty. I'm gonna unravel. I'm gonna explain to the fact that, hey, I'm gonna anti-suction you now, and you're not gonna like it because it's gonna be uncomfortable. Just don't lie to them. It's gonna suck. They are gonna hate it. You're gonna have to take someone in with you because typically they're gonna try to punch you in the face because it sucks. I'm gonna rub my catheter and my lube, and then I'm going to go down the nasal passage. Now remember, the anatomy of the nasal passage is it goes up and then it goes down. So I'm going to push up, and I'm gonna go with the anatomy. Now, once I've stimulated a cough or I've hit some serious resistance, then I'm gonna tell them, okay, and I'm gonna start pulling out. You can also ask them to swallow, which will help the catheter not come out of the mouth. So now I've hit here, and now I'm suctioning. I'm gonna pull out, pull out, pull out, pull out. Okay, now I've hit like where I've got getting a lot of secretions. I can sit here and I can put continuous pressure to get all those secretions out. Professor Carrion calls them hotspot. I just sit here. Once I feel like I've successfully gotten all the secretions, I'm gonna continue to pull out, continue to pull out, continue to pull out until I'm done. Don't just rip the catheter out. You're gonna fling stuff all over your friends.
Yeah.
Yep, perfect. So now I'm done. I'm gonna rewrap everything to keep it all sterile, okay? And then you're gonna say, okay, I'm gonna use my dirty hand to auscultate, listen. Oh, you're clear. You think you need to go again? I think you sound clear. Oh no, you think you're good? Okay, perfect. I think you're good too. Dispose of it all once you're done, okay? But again, the biggest part of this station is knowing how to do your sterile technique, okay?
What's the water for?
The water is for after, so if you're gonna go again, you take your catheter, you stick it in your water, clean out your catheter. Go back into your lube, get more lube, and go again. Okay?
Do you just clean it and suction?
Yeah.
Okay.
So you'll stick it in, you'll suction some water through your line, clean it all out, and then go again. So that's NT. Not super difficult, right? I mean, you watch me suck. I suck at those gloves. It's just what it is. ET tube suctioning. Okay. Wherever my dude is intubated, as far as like his numbers, right now he's intubated at 22 at the teeth. There are numbers on this suction catheter that I'm going to line up with my number that is at my teeth, okay? So if he's 22 at the teeth, I'm gonna look, I'm gonna say, okay, 22, and I'm gonna go down. I'm gonna push with force, I'm gonna lighten my hand up, and I'm gonna pull this plastic back. It keeps the plastic out of the way, it helps you visualize the numbers easier, because if you don't, you're gonna be like, oh, hey, I can't see anything. Pull that plastic back. I'm gonna look, okay, there's 22 at the teeth. I'm gonna sit here, I'm gonna hold my tube, always hold your tube. I'm gonna apply, 2-3 seconds of pressure, and I'm gonna start gradually pulling my catheter back. You're gonna listen, and if you think that your patient's got a ton of secretions, you can go again. Always remember to pre-oxygenate and post-oxygenate, okay? As far as when we lavage, these saline bullets fit right in here. You can put it in, you can instill your normal saline, and then you're gonna immediately follow again. And then you're gonna suction out. 3 to 5 cc's once. Sometimes you may have to do it again, but typically only once. Afterwards, if you have a patient that's got a ton of gross secretions, it's filled, your catheter, it's filled your suction line, it just looks bad, we want to go in, and typically you can do it with these because there's more saline in them. The tip of this flush will sit right here, okay? We're going to angle away from our vent because we don't want any saline going into our line to our vent because it can cause, at that point, every time they're getting a breath, saline's getting instilled into the airway. Also, if there's enough saline, it can cause issues with within the lines. It can cause resistance within the lines of the vent. So we want to angle away from our vent, and at the same time that we're pushing this saline, we're pushing our suction line. So we're instilling and pushing, because at that point, we don't want any saline going to our patient. We're pushing, we're suctioning, all of it should be going through our lines and flushing out our lines, okay?
So the catheter is already in there whenever you start pushing that, or is the catheter like that?
No, the catheter's out.
Okay.
Yeah,
like
so
that.
this lines up right here.
Okay.
So say you pulled out your catheter super far, you see it in the middle of that.
Mm-hmm.
If you see that and you want to flush your line, just push it down a little bit and then start to instill your saline and push your suction.
Oh, okay. I don't know why I thought we were talking about the lavage just now. I must have blinked whenever you said. We were
So,
flushing out
well,
the
when you're lavaging, you're gonna pull all the way out. You're gonna put it in here, but all of that saline is gonna go down the tube to your patient. So your catheter needs to be all the way out.
Okay. Okay.
But when you're cleaning out your lines, you want to make sure that your catheter is
Just
relatively, maybe just above where this is at. So that way, as you're pushing the saline and you're suctioning, all of that flush is going through your lines. Does that make sense?
Yeah.
Okay. Also with lavaging, at times you may see someone take the circuit completely off, instill saline, and bag to get the saline all the way down to the bases of the lungs. Don't do that unless your preceptor tells you to do it. We don't necessarily love to lavage, but sometimes it's necessary. Always, if they tell you, hey, go lavage so-and-so in room 10, say, well, okay, come with me, because if something inadvertently bad happens, then it falls back on you, and you want to make sure that you had someone in the room with you. I think that's relatively it. Y'all can practice. If you have any questions, let me know.